Good morning and hello everyone. Myself Dr. K.Govathi consulting homeopath, Pune, Maharashtra. आज swallowing awareness डे है. तो किसी भी चीज़ के लिए अगर हमें अवेयर होना है तो एजुकेशन उसका होना हमें बहुत ज़रूरी है. तो हमें अगर एजुकेट होना है तो वी हैव टू बी means we have to take the knowledge of that thing only, and then we will be aware of that thing. अगर अवेयर होना है तो एक्सपर्ट अगर हमें हेल्प करे तो देर इज़ नथिंग बेटर देन दिस थिंग. So today we have Dr. Govathi Nikhila ma'am with us for guiding us about the process of swallowing, then signs of difficulty in swallowing, and about many things which you have the questions you can ask also. So let us go live with Dr. Govathi ma'am and have the insightful knowledge from the expert. So I will just invite. Till then you can inbox में आप आपके questions भी दे सकते हैं. Okay. So Dr. Govathi ma'am will join with us in a moment. Till then, let us have some knowledge about this. I will introduce you to Dr. Govathi ma'am. We have taken the session with on the occasion of Women's Day also. At that time, we have seen that what is dysphagia and all that, and now we are having session about awareness about the swallowing. So there are very beautiful responses from the all over the audience on the YouTube also and on Instagram also. So let us have the privilege of having the expertise with us. So ma'am will join in a moment. So Dr. Govathi ma'am is a dysphagia specialist and speech specialist. She has research work in dysphagia also. She is certified VST FEEST, means flexible fibro optic endoscopic evaluation of swallowing and laryngeal sensory testing, video fluoroscopy, and much more. She has presented her work in many national and international international conferences, and she has awarded nationally and internationally also. So let us take a moment. She will join us because she has many consultations. So let us see. She will join us in a few seconds. Dr. Govathi Nikhila ma'am has a YouTube channel also, that is Dysphagia Speech Talks 74
09 also. So you can uh, subscribe that also and get the knowledge about dysphagia and about the swallowing awareness. उसका सब नॉलेज आपको इस यूट्यूब चैनल पे भी मिल सकता है. ओके.
Hi.
Hello.
Hi.
Hi. Hello,
Hello.
ma'am. Welcome. Welcome, ma'am.
Hi. Hi. Thank you. Thank you for inviting today.
Yes, ma'am. So today is Swallowing Awareness Day.
Yeah.
So, and let us. I have already introduced you, ma'am, but due to some technical problems, there was some delay in means accepting the your this thing request. So, ma'am is dysphagia speech specialist, and she works at Medanta Medicity Hospital at Gurugram, and she has a very beautiful work, research work, and she has published this work nationally and internationally, and awarded also. So let us today on this occasion of Swallowing Awareness Day, we will get educated and aware with this thing with very with the expert like Dr. Govathi ma'am. So let us start with our discussion. Okay.
Thank you.
So
Thank you.
ma'am, yes ma'am. So we will start with a very basic question. What is swallowing?
Okay. So today, actually, I would like to say, everyone, today is a Swallowing Awareness Day. So on this day, we are like creating and spreading the word called swallowing and creating the awareness on the platforms for the public, for the patients, for the caretakers, for the students, for the workers, professionals, everyone, so that everyone can get aware about what is it and how to identify whom they need to consult, and so that they can have a better quality of life and all. So today, I wish from this platform, it can help many other people who are actually wanted to know and who are actually looking for this and who wants to really come forward and support our team to, like, to more, do more,
Yeah.
many other programs and all. So coming to your
Yeah.
question, what is following is the ability in our daily life, whatever we do. We enjoy our food, we
Yeah.
eat, we start craving if we see our favorite food. That is all swallowing reflexes. That is controlled by our
Yeah.
nervous system, brain. Okay.
Correct.
So the ability of eating anything or the ability of drinking anything is called as normal swallowing. How does it take place? Whenever we are drinking or we are eating, the food goes from oral cavity to the throat and then esophagus into the stomach. This is the normal mechanism. So whenever we eat something, we masticate our food and our tongue pushes the bolus down to the throat, and our throat muscles helps the bolus to pass into the esophagus, and the esophagus pushes the bolus into the stomach. This is a mechanism.
Stomach.
So whenever we are swallowing, so there is also another mechanism which has joined together. That's a hidden thing actually. In our throat, there's a esophageal muscle. In our throat, there is a pharyngeal muscle, and you have a
Yeah.
respiratory system. We also breathe and we also eat from the same place
Same.
where it is called as
Correct.
neck. Okay, so from
Yeah.
there,
Yeah.
whenever we are swallowing, we hold the respiration and we swallow and we inhale. This is the normal mechanism. So for that fraction of
Yeah.
second, we hold our respiratory system will be on hold and we swallow. Any
Yes.
patient having difficulty in breathing, they cannot maintain the breathing capacity. They cannot hold the respiratory system. if they have poor respiratory mechanism, poor lung capacity, they have incoordination breathing and swallowing, gut discoordination here, then they will aspirate. If there is any, like बड़े लोग भी ये बोलता है ना बोलने का, like खाना खाने के वक्त
हाँ
बात
हाँ
नहीं
yes.
करना है, we cough, we choke
बात नहीं
whenever
करना
we
है. Yes.
eat. So whenever we talk, our
Yes.
wind system is open. So we talk. So
Yes.
whenever we are talking and eating, that goes into your windpipe and we start coughing. That enters into your lungs and then we
Coffee.
start coughing and we clear it up. In the patients, what happens, they don't have a poor, like, sometimes they cannot cough, they have poor cough effort, they have poor lung capacity, they could not cough and show you the signs. So they tend, that may
Yes.
lead to aspiration. Aspiration is like entering the food particles
Enter
into the lungs.
into the
Hope
lungs. Yes.
you're getting, yeah.
Yeah. Yeah. Yeah. Yeah.
Food
Getting it.
particles entering into the lungs, and that if we ignore or if it is not identified at the right time, it may lead to, like, aspiration, pneumonia, and then
Pneumonia.
sometimes death.
Yes, and that is fatal.
Yeah.
So it's important to have the knowledge. Means, you should be aware of these things also. So what happens if we ignore this, man?
Sorry,
Uh,
your voice.
what happens? What happens when we ignore this type of symptoms? Means
Yeah. If we
swallowing
ignore this, as
difficulties.
I told you, this is the normal mechanism, which I said, like, generally how we eat, how we enjoy our food. But in patients, what happens? The three phases which I have said, they have difficulty in that. The three phases they cannot
Yeah.
control. They have poor control on these three phases, or due to the functional, due to structural, or due to any mechanical obstructions. So they have difficulty in swallowing. So if they ignored it, or if they did not identify it, or if they have compensated with some other techniques on their own, so that will lead to
Yeah.
aspiration. That means, as I told you, that the food will enter into the lungs and creates the pneumonia. So
Yeah.
that is aspiration, right? So if they are not identifying it at the right time, the food particles enter into our lungs, and that creates the aspiration. If the prolonged aspiration can also lead to pneumonia and respiratory distress, and then the patient may collapse. And if the food
Yes.
intake is also not good at the right time, it can also lead to malnutrition and dehydration as well. So it is very important to identify at right time, and you have to note down all the signs and, like, characteristics of dysphagia, so that you can identify at the right time, so that you can overcome the aspiration and further complications.
Yes, ma'am. So what are the means definitive signs to identify about the means swallowing difficulties, ma'am?
Okay. So the red flags, I'll be sharing. This is very important to everyone who are watching this. Please do identify these sort of signs whenever you're enjoying your meal, or your loved ones whenever they are eating. If you find any sort of, like, this sort of signs, please do identify and, like, do consult a specialist immediately. The signs would be like,
Yes.
whenever you're eating or drinking the food, it gets stuck in your throat, or frequent coughing whenever you're eating, or regurgitating the food, or you're feeling choking takes place whenever you're eating the meal, or drooling and improper mastication, or they cannot chew it properly, they gulp immediately without mastication, they immediately swallow the food, and drooling takes place, and the throat obstruction of food bolus in the throat, or feeling hard burning sensation whenever they are eating, or vomiting frequently after eating the meal, or having GERD reflexes, feeling heaviness in the chest, or, like, whenever after taking one bolus, then they require some sort of water to push clear the bolus. They have respiratory
Yeah.
distress whenever they are eating, or changing of voice quality whenever they are eating, or, like, frequently required some sort of compromising with their diet modifications, turning it to mash diet, or choosing of different types of textured food only, preferring only a one variety of kind of foods. So these are the, like, techniques or red flags where we can identify if the patient is getting compromised, or turning towards this, or compromising with this, all the strategies, then we have to do.
Yes. So I hope
So
all
whoever,
are getting.
whenever they are eating, if anyone notice this kind of signs and symptoms, please do identify that these are the signs of dysphagia.
Yes. So audiences are getting clear about signs of the swallowing difficulty. So, ma'am, as dysphagia or swallowing difficulties, everyone at risk. But what are the group who are at more risk for this thing?
Sorry?
Who are who all are the groups of
Okay.
people who are at more risk for this thing?
See,
Yeah.
everyone are risk with dysphagia, everyone are risk at aspiration. Like,
Yes.
in our daily life, even normals, because of a work schedule, we tend to eat very fast and rush to the work.
Fast.
So we cough, we clear our throat, or we drink water immediately so that it goes quickly, right? So
Yes.
like that, according to researchers, even 11% of normal population will tend to develop with dysphagia or having aspiration in
Yes.
their daily life. Okay,
Yes.
and it despite of
Yes.
age, gender, and everything, like everyone are like they can have dysphagia at any time in their lifetime.
Yes.
And
Yes.
next, coming
Yes.
to if we talk about some disordered population, most of the time 80% of stroke patients will have dysphagia, and
Yeah.
80% of head
Yeah.
and neck cancer patients can have dysphagia, and 75% of respiratory patients can have dysphagia. And then critically ill patient, degenerative diseases, and cerebral palsy all to mix and match comes to around 60 to 70, in between 60 to 70% of dysphagia. It's a secondary
Yes.
cause
And
actually.
yeah. Yes. Miss, how important is this, Miss, to get aware about this, ma'am, according to your Miss practice and
See, it is
evidences
very
you have
important
get
to
from your
create
patients?
an awareness and to know, like, it should reach to the common public first. Because if we are not identifying, or the patient caretaker is not identifying, unaware about, like, unaware about the swallowing and signs and symptoms and all, they tend to feed the patient because of their
Yes,
poor muscular coordination, because of their inability to swallow. Sometimes it doesn't show the signs which I've told you. Because of the weakness, they
yeah,
doesn't cough, they doesn't show you any signs. Silently, they tend to aspirate. In that case, the patient, what is getting visible outside, the patient is swallowing the food, right? चलो खा
yes,
तो रहा है. This questions, this were the
हाँ,
common questions which I faced from the patient. जब मैं
yes,
जाके बोलूंगी नहीं खाना मत देना है, even I feel bad at that moment that I'm stopping their food, but at the same time I
yes,
have to seek for the
but
protection, right? So when I
yes,
say, then
important.
the attendant, like, the caretaker will tend to say that खा तो रहा है, नहीं नहीं अच्छे से चबा के
Hmm.
खा रहे हैं, नहीं नहीं हम उनको दे रहे हैं, अभी तक
हाँ,
बहुत कुछ खा लिया था. बट
yes,
माई क्वेश्चन
yes,
टू ईच एंड एवरी वन इज दैट कौन नहीं खाता
हाँ, नहीं खाता है ये.
है ना? कौन नहीं खाता? सब खाता है.
हाँ,
जो भी चीज आप यहाँ डालो
हाँ,
वो तो जाना नीचे ही, पर जिस
जाता नहीं
तरीके से
है.
जा रही है वो हमें देखना होता है ना?
That
तो
is
बेस्ट
important. Yes.
एग्जाम्पल इज, चलता
हाँ,
तो
yes,
सब है, चलता तो आप भी है, चलता
हाँ,
तो मैं भी हूँ, चलता वो भी है जिसको एक पैर नहीं है, बट कुछ फर्क
हाँ,
हमें बाहर
वो
दिख
तो
रही
है.
है. चलो इनको पैर नहीं है, इसकी
Yes,
वजह से इनका चलने का जो लाइक वॉकिंग स्टाइल इज डिफरेंट,
gait
and
है.
he is
Yes,
walking very
gait
slow
is
when
different.
compared to other, which is visible. But this is not visible. So it
Yes,
is very difficult for me to counsel anyone. Like,
yes,
tell them like, nahi, is tarike se ho rahi hai, is tarike se ho rahi hai, and then I show them in some objective evaluation, see,
yes,
this is what happening, and then it's very difficult to convince. So if they identify that, if they know about this, they can,
hmm,
like, they know the importance of this, and they know the consequences after feeding and all. अगर ऐसा ही देते गया है, that will enter into their lungs, and that increases the secretions that collapse their lungs, and they'll land up
that
with
will
ventilation and
complicate
severe
the case
respiratory
also.
related issues and all. So it is very important to identify everyone that it is a, like, critical thing which may turn to a like higher consequences. So it is very important to identify this and be aware
Yes,
and
ma'am.
protect your loved ones.
Yes, ma'am. And how you counsel, ma'am, to your patients with your means soft skills and teachers or whatever that
Yeah, I'm
means with
so sorry. I
which
cannot hear your voice properly. I'm sorry.
uh, hello, hello,
Yeah,
hello.
yeah, yeah.
Yeah, ma'am, we want to know how you educate your patients or the people they come to you for consultation with means soft skills or picture presentation. What type of
See, for
method you
students
use
who wants
to
to learn
educate?
about this, or for the professionals who wants to learn for this, there is a platform called Dietitian Research Foundation. So through this platform, I'm educating the students, and I'm also helping them for the researchers, and whoever professionals want to join their hands, they can come and join this platform. And for the
Yeah,
patients who wants like a consultation or a counseling session, or a professionals who wants to ask the queries and all, I'm sitting here in the Medanta. They can approach me anytime, so I can help them from here.
yes,
And we also have a video consultation. I do help them if I can help through video consultation. Of course, not swallowing assessment, but definitely I can
yeah,
counsel and see the patient through that.
yes, ma'am.
Yeah.
And one more question I have in my mind. What are the means psychological factors means which are contributing for the swallowing difficulties, ma'am?
See, each and every patient undergo with psychological distress यार. Like देखो अगर
Yes.
to be frank, अगर कोई आपको भी मना कर रहा है नहीं खाना है, तो you get like
हाँ,
अरे मेरे को मना कर रहा है, we feel bad.
right, right.
That is also a
हाँ, yes,
normal like tendency where we go negative. अरे मेरे को मना कर रही है, you feel bad, you go down, you feel like मेरे को खाने नहीं दे रही है, you'll go into a negative zone. The same happens with the patient.
हाँ,
They have their like meals in front of them, but they are not able to eat that. They're not able to swallow their saliva. They're not able to enjoy
yes,
their meal. But at that point, we have to motivate them, despite of saying them that you're not able to eat. I think we have to say, if you do this, you will be able to enjoy your food. We have
yes,
to talk about
yes,
the positive side by making them like push forward like no आप ये अगर थेरेपी कर दिया ये एक्सरसाइज कर दिया अगर 2 दिन आप इस ट्यूब को रख दिया है आप इस तरीके से चीज जो जो हम बता रहे हैं आप वो करते गया है तो you can enjoy your food you will come out of this tube the only positive motivation and positive counseling is needed because each and every patient who is not able to eat will have a psychological illness
psychological factors,
yeah.
yes, yeah, definitely, yes, ma'am. And we want to know about your journey, how you started with means doing work and all these things with the dysphagia means field. We want to know, ma'am, your journey about this.
See, my journey from here, Medanta, it's been started from 2016 and 2015 ending like that. So when I have reached here, I was like a newborn baby where I don't even know this way ka D kya hai. So I used to see all the elderly patients like with tracheostomy and suctioning. It was a very big thing for me. अरे बाप रे ये क्या क्या कर रहा है मुझे क्या करना
Yes,
है because practically we don't I really
we
not
do.
have that good hands at that moment so I was
Yes,
like, chalo, but it's something interesting. And then I thought like, acha, isko tracheostomy kehte hain. And then I used to discuss with the doctors and we used to do some papers. I
yes,
have like, even they have supported me for research papers and all. The team at Medanta has a good supporting system. Like, they encourage a lot to do like more researchers and we have a huge patient flow. So where I got a good
yeah,
exposure here to learn more actually and this is a good platform for
yes,
me that maybe that is the reason
yes,
I'm sitting here today in front of you so that's how like
yes, ma'am.
I used to study in the night and then come back ask the doctors like question and answer kind of thing I used to learn and then I used to implement it on the patients and then the patients get recovered that motivates me more chalo I'm doing something good and the tube is coming out which is
Yeah,
unique and they are enjoying that food I'm offering something so that made me more interest into this and then I thought
interest.
अगर न्यूरो में हो रही हो तो रेस्पी में भी होती है रेस्पी में हो रही हो तो onco में भी होती है so this is the platform where we
Yes,
have all of the different areas like respiratory and all then I used to rush there and see
yes,
the patients and that is of my journey took me here today
yes, ma'am. Yeah, ma'am. Very means inspiring and motivating.
yeah
Yes, ma'am. And lastly, I want to know about what are the advanced treatments for dysphagia, means anything new added we want to know.
see
Yes, we
for
can avail
assessment
the
part
patients.
for assessment part, we have instrumental evaluations like, fiber optic endoscopy, where we pass the endoscopy tube and see the swallowing reflexes whenever we offer them a food and see the swallowing reflexes, whether it's aspirating or not due to any structural abnormality or any functional this thing. And at the same time, we do a video fluoroscopy study where we and a modified barium studies where we make the patient sit in front of the X-ray and offer them food, and we track how the mechanism is going on, how the patient is able to swallow. What is the function? Is it functional or structural related thing? We have a manometry where we track the bolus velocity and under the graph, and we do upper GIs and all to see whether there is any narrowing of esophagus or like there is any strictures, so that we can plan for further management and all. And then for coming to the therapeutic part, we do a rehabilitative point of sight and surgical point of sight of the end. So rehabilitative point side, we have certain oral exercises and all we provide for the patients, and then we have electrical stimulations where we do electrical therapy for the patients to stimulate the muscles. And for some patients, it is also maybe required the Botox injections to release the nerves to make free the nerve sensation. And we have surgical management as well. And some patients, we have a medical management as well for the myasthenia gravis patients. Sometimes they need treatments like medicine. So that we have we discuss with the doctors, with the team, and it's all about interdisciplinarity, where we discuss with the team and we take a call like what the plan can be done further. These are advanced technology programs.
Yeah, holistic approach.
And we also have
counseling.
We also have some diet modifications. We have thick naps. We have diet modifications. So we also request the dietitian to modify the diet accordingly the patient requirements, so that they can have a safe swallowing.
Yes, and means the holistic approach is there. Means counseling, diet changes, along with medicine. ये सब चीजें मीन्स होलिस्टिक अप्रोच ही हम बताएंगे ना पेशेंट्स को कि ये सब करना होगा, सिर्फ मेडिसिन से या सिर्फ सर्जरी से ये नहीं होगा। मीन्स आपको भी कुछ एफर्ट्स करने होंगे, मीन्स पेशेंट को भी कुछ एफर्ट्स करने होंगे टू गेट आउट ऑफ दिस।
एंड इट इज वेरी इम्पोर्टेंट, अगर कोई ये साइंस नोटिस कर रहा है तो किधर जाना है, कहाँ जाना है, किसको मिलना है, बिकॉज इट इज ऑल्सो वेरी इंपॉर्टेंट। लाइक सम पीपल, अगर कोई ऐसा सिम्टम्स देखने के बाद भी डजंट स्ट्राइक इन देयर माइंड, they go to ENT specialist, they go to gastrologist, they go to, it's good that reaching a physician first, but at the same time, if they know, these are the dysphagia signs, we need to consult a dysphagia specialist immediately. So then the time will, reaching the person, time management and early treatment will make the patient to overcome, recover earlier. So it is very important, if you notice any sort of this dysphagia signs, do consult a dysphagia specialist immediately nearby your location.
Yeah. So early diagnosis and early starting of the treatment will save the lives.
Exactly. That can save their time, that can save their lives. So meeting, identifying the right person, consulting the right person, identify going at the right place at the right time can save anyone's life. So it is very important, you have to reach at the right time. Early identification is very important. Whatever signs have been told, please do check. If you observe anyone, please do educate them so that no one can go to the respiratory distress and all these consequences.
Yeah. So on this Swallowing Awareness Day, we learned about many things, ma'am. So grateful to have you on this platform for educating and awareing people. And thank you so much, ma'am.
Pleasure. My pleasure. Thank you. Let's all spread the words called swallowing on this day. Let us all educate everyone. Let everyone know about all the signs and symptoms so that everyone can have their better quality of life and enjoy their meal. Thank you so much for inviting me, Dhanushri. Thank you.
Yeah, thank you, ma'am. Pleasure.
Bye.
Have a nice day.
Good day.
Yeah,
Good
bye.
day.
Yeah.